This is Our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hi and welcome to Our People podcast. My name's Harry Newhouse. I'm a PR and social media assistant within the comms team here at the Trust and will be your host for today. Over the next 2 months, we will be talking to members of staff who are involved with the Big Health and Wellbeing Team Talk. We will be finding out just what that is, how it will help our patients and staff, and what's involved within the campaign. Today's main topic of conversation will be about health literacy. And with me today is Health Literacy Officer Lorna Dawson and Population Health Lead Fiona Carney. Welcome, Lorna and Fiona. So, Lorna, could you please explain what your role is here at the Trust and what it involves on a daily basis?
Yeah, so thanks for having me, Harry. So my role is a really new role. I don't know if there's many health literacy officers even in the rest of the UK. And I've been here for 3 months, and the health literacy work is really new. So I've started by actually working out what we should do, because health literacy can affect so many different things. So we've had to decide which bit we want to focus on for the first year or so. And in the Trust, we've kind of chosen written materials and mainly patient information leaflets. So the Trust has over 900 patient information leaflets. So what I'm going to be doing is looking at what kind of levels are they written at the moment, what reading age are they written at, and then looking at kind of whether and how I can change them to make them easier for patients to understand. And then I'm also looking at kind of, we don't just want the health literacy team to be able to do health literacy, we want everybody to be able to do health literacy. So what support do staff need to be able to do that? So looking at training, and then also how can we do kind of health literacy longer term, what else can we feed into?
And same goes to you, Fiona?
Hi, yeah, so I'm Population Health Lead here at the Trust, and I've just started, I'm just new into the role, just less than a month into the new post. So my role involves working closely with colleagues across the organisation, our local system partners, as well as regionally as well, to improve population health so that our communities are healthier and able to get more out of life. And I think that fits in really nicely because within the health literacy team, so I'll be supporting Lorna and the team, looking how we can implement that across the organisation. So prior to starting in post, I've been involved as project lead with health literacy for about 12 to 18 months, and that's been working closely with a lot of colleagues across the system to understand what is health literacy, why it matters to the organisation, and then what we can do about it. So as part of that, we started then thinking about we need to build a team to be able to support the ambitions of the Trust. And so that's the start of our journey so far.
So you mentioned how you explain what health literacy is. I'll let you do that.
Yeah. So there are lots of definitions of health literacy. There's over 200. One that I use quite a lot is from the World Health Organization. So they say that health literacy is the personal characteristics and social resources needed for individuals and communities to access, understand, appraise and use information and services to make decisions about health. But that sounds a bit wordy.
Yeah, so I think it still sounds a bit complicated. So for me, I think health literacy is about communicating health information clearly and understanding it correctly. To put it in simple terms, I would say.
And it sort of relates to everyone's role here, because it's certainly in the comms department we've been having to make sure we have a readability of a certain age for even our staff magazines, for anything that we put out within communication. So it's a huge part of what we do nowadays, isn't it?
Yeah, and I don't think people realise how many strands it cuts across everywhere. So it could be, when staff are talking face to face with people and patients about the the environment of the hospital, you know, our signage to help people navigate around the health system. You know, we know what certain departments are, but not all patients do, and it's, you know, it can be quite a scary time for patients when they're coming into a hospital setting. So it's not only written information, but it's the verbal communication as well, and all about the signage as well. So it cuts across, you know, people having telephone conversations with patients about being very clear and making, if they've got to give them instructions, making sure that's simple and it's clear for patients to understand. Because in the NHS we're so used to using jargon and acronyms that we know because we work in the health system, but you know, a lot of people don't understand that. And people just don't like to question people and or ask them to repeat, or that they don't understand. So people will just quite often just nod and yes, I understand, but they don't.
And this goes in with what we're doing with Big Health and Wellbeing Team Talk. Do you want to explain what that is and how health literacy fits into it?
So we talked, like Fiona talked quite a lot about understanding. So yeah, if people have good health literacy, they'll be able to understand the information they're given. They should be able to understand a little bit kind of about their health. And if they don't understand, as we've said, people can feel frightened, people can feel scared, they don't know what's going on, and it's probably a scary time for them anyway. So that will affect their health and well-being. And if kind of, they're stressed, their physical, that's going to have an impact on their physical health. But if people do know where to go for reliable, trustworthy information, if people do understand what that information means, they can follow that advice, they can do things themselves, they can do self-care to help their own health outside of the hospital setting. And that gives them a massive feeling of control and empowerment, which is what we want for kind of patients and their health. And they can tell us what they need as well. So if they understand what's happening to them, they can say, oh, actually, I think I'd prefer it this way, or I need it this way. So would they like a tablet or an injection, for an example? They can tell us that and feel less stressed, and there's a better relationship. And they'll feel like, they're getting more out of their care.
Sounds really good, health literacy, but like who does it affect, and how does it affect them?
So I'd say low health literacy affects a lot of people, but we thought, rather than kind of telling you outright how many people it affects, we thought we might do a little quiz, if you'd be up for that.
Yeah, I'm definitely up for that.
Yeah, cool. So we've got 4 questions. So I'll start with, these are kind of percentages. So and if you're not sure, have a guess. What percentage of adults do you think would struggle to understand health information that was just words? So maybe like a self-help leaflet.
I'd say about 20%.
Okay, so 20%.
30%.
So it's a little bit higher than that. So it's about 43% of adults, in England would struggle to understand health information that's just words. Now, with that in mind, what percentage of adults do you think would struggle to understand health information that had words in it, but also numbers? So something like medicine instructions.
I'll go a bit higher this time, and I'll go 35%.
Okay. Oh. So it's just under double that, actually. So it's about 61% of adults would struggle to understand that information. And that has massive implications if somebody is having difficulty understanding their medicines and if they take them wrong. So it can be quite a serious problem. Question number 3 is, what do you think is the average reading age of the UK working population?
I say probably 16.
Okay.
16
Lower?
Lower.
Yeah, so the average reading age of the UK working population is actually 9 to 11 years old.
Wow.
So yeah, if we think about all the information that we write, and I don't think many people know that or realise that. And if we, next time you look at some health information, kind of have that in mind. So yeah, that's kind of like really shocking. And then the last question is, what percentage of critical information do people forget or do people remember after they leave the doctor's office?
I forget quite a lot of information sometimes. So I'd go probably about 40%.
Oh, that's close.
Oh.
So yeah, people forget about half, 50% of what they're told. So that's quite a lot.
Yeah.
And it has massive implications of, when you go home, if you can only remember half of what you were told, how helpful can you be to yourself?
I think that really emphasises just how important health literacy is, and the fact that I got most questions wrong there.
Was that deliberately meant to do?
But yeah, it really does emphasise it.
Yeah, I think as well that I think we'll all have health literacy needs at some point in our life. Because sometimes it's quite situational. So if it can be more challenging, obviously, when you're sick or you're in pain, and even somebody with normally high levels of health literacy, they might struggle at times to process and understand information. So if they're in an appointment with the consultant and the consultant has given them bad news, they've got heightened anxiety anyway, going in wondering what the news is going to be, and as Lorna was saying there, 50% of the information they don't retain. So you're going in already heightened, and your ears are blocked, and so at certain times in people's stages of their lives, they will at some point have health literacy needs. Could be when they've got a new health condition, or when they've got multiple health conditions as well. Too much information and lots of jargon and information overload. So we need to try and strip that back and make it as simple as possible for our patients to understand the information.
So what does good health literacy look like?
So I think going back to that kind of World Health Organization definition, so it's people being able to get, so the first one is access. So people being able to kind of get the information that they need, whether it's us giving it to them or whether them being able to go to the library and get online. Then it's them being able to understand that information. So kind of as a trust, we're really consciously trying to make the information easy to understand. So using like simple words, so that if people are stressed, hopefully they can still understand what that means. It's kind of, maybe around people actually knowing how to check whether information's reliable or not. So in the pandemic, there was a lot of misinformation, so knowing what's fake news, what to not having those skills. And then people feeling empowered, people feeling in control of their health because they've got the information to make those decisions, and people knowing that, they're making an informed decision is what I think good health literacy looks like for me.
Yeah, and I think you're right as well, and I think for people to be actively involved in the care, they need to know what to do, how to do it, and why it's important. And if we can get that across as simply as possible, that'd be great.
And then I guess for an organisation, what does good health literacy look like in an organisation? It's people knowing that there are barriers to people understanding health information and knowing how to overcome those. So knowing that we need to write in a simple way, or knowing that people might forget half of what's said. So checking what they remember before they leave, or asking, do you need to write any of this down? So things like that.
As you mentioned in the show earlier, saying there can't be many health literacy occupants out there in the NHS. So, how did you get into this, and is it a growing occupancy that's happening right now?
Yeah. So my background is in libraries. So I'm qualified as a librarian. And so I worked in health libraries for about 5 years. And I started with health information. We had like a leaflet collection, which is where I'd order in leaflets from, say, Diabetes UK or British Heart Foundation or Mind, so that public health professionals could come get their leaflets and take them out to stores and things like that. And then I got a slightly different job. It's still kind of in like health libraries, and that was teaching people how to spot misinformation, so teaching people to spot good and bad quality health information, but also raising awareness of the problems of health literacy, of those statistics, like running quizzes, like I've done before. And that was definitely one of my favourite parts of the job. And so when I saw this one come up, it was like nice. So I'm not just raising awareness now, I'm actually kind of changing and making a difference. I'm actually able to make some changes.
And Fiona, so you worked here previously before your job that you've got now?
Yeah, I've worked in the trust for about 9 years now, and so I was project lead for the patient engagement group, the theme within the health and wellbeing strategy. So as part of my project, health literacy sat under that. So I got into it really, there was just myself and Ryan Swires just working out, so what is health literacy, what can we do as an organisation, and sort of scoping out as a trust, what could we do about this? Because it isn't new, but it is worldwide, there's research going back over 20 years or something, but it is relatively new. Coming into health literacy, coming into the NHS is relatively new. So I got into it that way. It was one of my projects that I was supporting the organisation with. So I got into it that way, but I'm really passionate about it because I think it cuts across everybody's role. We're here to look after patients, and we all communicate with patients or our local communities, and we need to be able to do that simply and effectively.
The very different ways of getting to the sort of jobs that you're at now, isn't it? And,
yeah, absolutely.
Do you have any tips on how to write in a simple way?
Yeah, so I think first of all I would say that the terminology that we use in healthcare can be quite confusing for people sometimes, especially when people are stressed and they may be struggling more than usual to take in information. And in the NHS we use lots of jargon and acronyms routinely. And I think we might sometimes forget that this language is unfamiliar to our patients and our service users. So it's just really trying to go back to the basics and trying to simplify it and try not to use as much jargon as we do. And I think Lorna, you're going to do a little quiz with Harry, aren't you? We've got some words here, so we want you to come up with an alternative word.
Yeah. So this is a lot of what I do. A lot of what I do is looking for the hard words and trying to think of simpler ones. So I thought you'd put you in my shoes for a minute or two. So I've got a list of some of the common kind of hard words or long words that are used in trust information. So if you could pick a letter, I'll give you a word or a phrase, and then you've got to try and think of a simpler way of saying it.
I'll go for C.
Okay, so C. Quite a commonly used one is comply with.
Okay.
So is there a simpler way of saying that?
Would that be follow?
Yeah.
Yes, well done.
Okay, do you want to
Finally
pick
got one right.
do you want to pick another letter?
We'll go with S for Sunderland and South Tyneside.
Similar to?
Similar to.
Similar to something else?
The same.
Yeah. We've got or like.
Oh, yeah.
It's like this. Do you want to do one more?
Can do. I quite like this game. I'll go A.
Okay. How about abdomen?
That's the stomach, so that's tummy.
Yeah.
Mm-hmm.
Yeah. Well then, yay!
Better than the last one.
But yeah, definitely a tip is looking at if you've written any information, like try and spot the hard words and try and think of an easier way of saying them, or how you would say them to a friend who didn't have a medical background. And then I think other things that I do when I'm looking through people's writing are kind of making the sentences shorter, because we tend to try and, well, I say cram in, we tend to try and fit a lot into a sentence, and it just ends up being lines and lines and lines. And it's difficult to remember all of those things. So if you just do short sentences with one idea at a time, it's much easier for people to kind of just focus on that one sentence and understand it. And also use kind of short words.
So what can people at the Trust do to help yourselves and the rest of the health literacy team, as I'm sure that you all be working very hard?
So what we've been working on for Health Literacy Month, which is October, and for the big Health and Wellbeing team talk, is putting together our intranet page and giving lots of useful information and tips and support for how people can do health literacy now. Because we are looking through the leaflets and we'll be approaching teams kind of when we're editing their leaflets, but people can think of health literacy now. So I definitely recommend them going to the health literacy page on the intranet. So it's under the prevention tab, and we've got a video. So watch the video. It's got Ken, it's got Liz, it's got me. So watch that, and also look through the links. We've got kind of how to check the readability or the reading age of your document, and also how to write in a simple way. So I definitely recommend checking those things out.
Yeah, and I would echo all of that really, and I think the health literacy team obviously you're going to provide a systematic way to for staff to be able to develop and produce health information across a trust, which is easy for people to understand, and we'll be doing some awareness training as well, won't we? We'll be rolling out some health literacy awareness training over this next year as well, so people keep a look out. Obviously we'll be putting it on the staff bulletins once we've got dates secured for that, and also on the intranet page as well, so people can keep an eye out for that, and they'll be welcome to come along to that. So I think there's going to be lots going on over the next couple of months, and I think the team's going to be really excited to get out and about across the organisation, and I think the Trust are really committed to making sure that the health information that we give to patients matches our local reading age. So there's a big commitment from the Trust, so lots of work going on over the next year.
Right, that sounds excellent.
Yeah.
I've had plenty of fun here today. Thank you very much.
No prizes though. We'll get you a prize, Harry.
Thank you very much, Lorna and Fiona, for joining us here today, and for sharing what you do and showing the importance of health literacy.
Yeah. Thank you.
Thanks for joining us for this episode of our People podcast. We hope you enjoyed it, and check out our other stories. Hit subscribe to keep up with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.